Okay, welcome back to the In Motion Pregnancy video series. This is our self-myofascial release series for preventing pain during pregnancy. Again, I'm Dr. Luke Weingart, chiropractor.
And I'm Cassandra Weingart, physiotherapist and 34 weeks pregnant.
Alright, so our first in our 3 release moves is going to be the low back foam roller. Foam roller is going to be an important tool for managing pain during pregnancy and beyond. We also recommend using a ball, a lacrosse ball, or an acu ball as another release tool, but we'll get there. Starting with exercise 1, Cassandra's going to begin sitting on the foam roller. This is stable, this is a great place to start. What we're trying to work here is the tops of the glutes and into the low back muscles. Sometimes those muscles are working hard to stabilize you as your body changes. This is a way that you can work to release that tension and try and help manage any discomfort you're having. So Cassandra's going to set her arms back. Perfect. From a seated position, she's going to roll the tops of her glutes slowly back and forth over the roller. Myofascial release is about time. Time creating pliability in your tissues. So take your time. Each of our release moves, you should spend 3, 5, even 10 minutes on. Slowly back and forth through her hips. Cassandra's going to walk her legs forward and roll into her low back. Again, moving slowly, pain-free. Use your arms and legs to control the movement. As she works the base of her back, she can walk herself out a little bit further and maintain nice and controlled movement back and forth on top of the roller. Okay, we're back with our second move in our 3 self-release moves during pregnancy. What we're going to want to work here is the lateral glute and hips. We started off working the tops of our glutes and our low back. Now Cassandra's going to move on to her side. Again, supporting herself on top of the roller with her arm and her feet. She's going to step across. Right now she's going to be working the top side of her glutes. Again, with each of these release moves, we want to spend time, 3, 5, 10 minutes per region. Slowly back and forth. Cassandra's now sort of on her gluteus medius. She can move forward with her body weight and get a little bit more into gluteus minimus and the tensor fasciae lata. Slowly back and forth. She can work her way from those muscles on the top of the hip. She's going to skip over the bump or the greater trochanter and get herself onto her iliotibial band and slowly release through there. These moves are a little bit of effort. It's important to take your time and spend the time not only to get comfortable with using the roller, but with releasing the tissues. Okay, now this is our third move in our myofascial release during pregnancy. A ball. We use the foam roller for the first couple. The ball allows us to get much deeper into the tissues we want to work. I'm going to have Cass go hands and knees just so I can show you the area that we're trying to get at. In our glutes, right, we've got our tailbone bone, we have our low back, and at the side of our hip, we have the sort of bump of bone there called the greater trochanter. The space between tailbone and greater trochanter has a lot of deep musculature that can get very uncomfortable and create a lot of pain during pregnancy. We are going to situate this ball in that space for this movement. It's always a good idea to foam roll out the low back and glutes in the first 2 moves before we get after using the ball. Roll onto your back here for me, Cassandra, please. I'm going to allow you to place that ball in that space. We're going to look to tuck it, again, between greater trochanter and tailbone. She's going to place it there and then roll her weight on top of it. You may need to start here. Our preference, however, is to open that space by taking this heel and placing it on this knee. If you cross yourself up, you've now opened up that space. I always tell my patients, you're looking for the discomfort in there. I want you to find the sore places with that ball. When you find them, spend some time. Again, you've heard in every video in this series, 3, 5, even 10 minutes per region. Rocking slowly back and forth. Can you feel that one? Yeah.
Oh yeah.